Alive and Well STL is a presentation of the St. Louis Regional Health Commission and Rare Gem Productions to build a healthier St. Louis. Power up with the positive. Learn more at oneraregem.com. That's ONERAREGEM.com. The Regional Health Commission works in partnership with regional health sector advocates and stakeholders to improve healthcare access, reduce health disparities, and improve health outcomes for the uninsured and the underinsured in St. Louis City and County.
Alive and Well STL.
Alive and Well STL teams up with the Forsake of All project at the St. Louis Science Center. So we extended our microphones to participants who wanted to share and join the conversation.
Issue is, are you part of the problem or part of the solution? And today the whole idea was to be part of the solution. What are you going to do to make things better?
This is producer Jade Harrell. We'll be right back. Sometimes you gotta dig in to be alive and well.
Don't ever be afraid of who you are. Be exactly who you are, even if that stands out and is nothing like anything else that you see.
Sometimes you gotta carve it out.
Be exactly who you are without apology. And it may not look like the person to your left, to your right, in front of you, or behind you, and that's okay. Be authentically who you are out loud and on purpose and unapologetically.
You deserve to be alive and well. Learn more at aliveandwellstl.com. Alive and Well STL. Alive and Well STL teams up with the Forsake of All project with experts on mental health to speak about emotional well-being and why it matters. We extended the microphone to participants who wanted to join the conversation. Meet Evelyn and Gladys, friends and advocates committed to improving the well-being of people in our region.
Welcome to the Alive and Well STL podcast.
Thank you.
And these two ladies keep looking at each other like, what is she getting ready to say, do, or have us do? Now, Evelyn joins us, and Gladys. Evelyn, I'm going to start with you. So, Evelyn, were you in the presentation room for the Forsake of All Emotional Wellbeing Forum?
Yes, ma'am.
So you did get to experience the presentation.
That's right.
Tell me what the experience was for you and what you gleaned from that conversation.
Well, I think that basically it brought home all of the things that we have been talking about in training and teaching and working for over the last 40 years in St. Louis to try and get people to recognize and understand that there is a mind-body-spirit connection, and as Bethany said, that we are all connected with regard to the spirit and the body, and that if you're not in line spiritually, then you're not in line mentally, and eventually you will be impacted physically. And that 87% of illness can be tracked back to the trauma and the experiences we had in childhood. Now, we all know this, but we don't really address it and work it. So the issue is, and I think one of the trainings I did back in the 90s was, are you part of the problem or part of the solution? And today the whole idea was to be part of the solution. So it's about, what are you going to do to make things better? You yourself, not to make yourself a person out there showing up as Miss PhD, whatever, but what are you going to do for the babies? That is your North Star. What are you going to do for the children? How are you going to make it better for the kids tomorrow? Not for you yourself necessarily, but if you make it better for somebody else, you're going to make it better for yourself.
Well, Miss Evelyn, you said that this is something that you've been trying to convey for 40 years, so you've been at this a while.
Yes, ma'am.
Tell me about the work you do and the training that you experience and where it's applied.
I'm a family therapy specialist, and I work with children, youth, and have been doing that both in New York City in the 70s as a child development or a family therapist when they had the fiscal crises and got rid of all of the family counselors in the city. And then we were in the all of the child development centers, and they decided they could not afford it anymore. So that's back to the economic piece that we were talking about today.
I think it goes back to the part of, are you a part of the solution or part of the problem?
Part of the solution or part of the problem.
Because the solution was stripped away, or at least part of the solution.
Well, again, and it was back to economics again.
Sure.
They said that they couldn't afford it. But then we were working with the National Council for Negro Women and helping to work with parents and children and youth, single parent project of New York City. And some of that got, put on the backside. But then again, coming here to St. Louis, that came back here at Guardian Angel Settlement Association with Provident Counseling and all of the organizations here, again, working with the daycares and the programs and working with people who had illnesses, but also people who were economically disadvantaged.
Sure. So if this is work you've been at this long, what has changed or what progress has been made, and what hope do you have after being here today?
Well, I see progress. I saw progress in New York there, working with Columbia University and Morningside Heights Community Center. Some of the same things that they were putting into place there were being put into place here in St. Louis with Washington University, and the programs that were down around Guardian Angel and St. Louis University and Washington University, and the North County Cares program was really good. So we have pieces of it. We have Washington University reaching out into the community and being involved in the area, as a practicum instructor, as a teacher for WashU, as a practicum instructor for St. Louis University, and a teacher there. That's part of the work, and also as an EAP person going out and teaching courses, minority communities.
Are these all you? You've done all of these things?
Yes, ma'am.
So Proverbs 31 is you? That's a lot. But what you said was that how can we personally, I got you at that one. I love it to make you smile, catch you off guard. But in this work, it can be disheartening and challenging, but you have stayed the course and have made your personal.
Well, but it has been a blessing. It has been fruit.
Share the blessing.
Because I get calls from people that I saw 40 years ago, 30 years ago, or people run up to me.
What do they say?
And they say, "You don't remember me, but I remember you, and you listened to me, and the words that you gave me or what you said to me really, really helped me, and I got the help that I needed," or "Yes, I'm now taking medication, and you won't believe what I'm doing." And these were children, and they're graduating, and they're going to school, they're getting degrees. Some of the women I saw in New York went on to nursing school and became nurses. Some of the women I saw here in St. Louis went on and became social workers.
Look at that.
And,
that's powerful. That's
go.
Very powerful and rewarding. So you've blessed many lives with your listening ear, your compassionate heart, and your words of wisdom. As we're talking about Alive and Well in STL, and then also for the sake of all, emotional well-being, share some of your wisdom for our listeners that can help them, bless them with their part, their lives.
Well, you have to take care of yourself too. We go to the chiropractor, we do the yoga, we eat right and exercise. You practice what you preach, and you have to have that spiritual background as well. You must be willing to give, to live it, and it's not all about me. If that there's a service to people that people can't afford to pay, and you see them, and you just see them, and you just talk to them, and you give, and it's part of what you do, and that gives back to you. It feeds your soul, and if you feed your soul by taking care of somebody else, then you will be well fed.
You just got me with that. Now, I was going to say that's for the listeners, but you got me with that. So we're going to come over here to Miss Gladys. Gladys, you also were in the forum, and maybe you can share with us some of your takeaway from that experience.
Yes, I was. It was wonderful hearing the connection of the mind, body, and spirit. That was the one thing that got me the most, is that the connection. I fought for that, just like Evelyn was talking about mind, body, and spirit for so many years, and that was the one thing. And the other thing is that it's not all about you. is how you're connected to others and how you're connected to your community. That's my big takeaway from all of this.
Is that also from personal experience?
Most definitely. My business is mind, body, and spirit, mind, body, and soul. I've been in the military for 27 years, and that's one of the things. You take care of yourself, mind, body, and spirit. The esprit de corps, learning about yourself, connecting with others, connecting with the team. So I started doing that, and I just ingrained that in my life and with every patient that I work with.
We talk a lot about healing with this work. What have you implemented in your life to address areas of healing for yourself?
One of the things is, as a clinician, the first thing is to take care of yourself, take your pulse. So in the middle of my doctoral program, when I was busy with everything, one of the things I noticed is that I wasn't taking time. I decided that I wanted to take yoga. I started yoga, and I ended up being a teacher for yoga. So not only am I doing it for myself, but now I can help others do it.
That's lovely. Do you have some encouragement? Now, I noticed when we talk about connectivity, here you two doctors are hanging out together. All right?
Right.
There's obviously a loving, supportive connection. Look at that, giggling already. Between you two. Can you speak a little bit about that and the value of that for our well-being?
You know what's interesting about our relationship is I can see her 2 years from now, 5 years from now, 3 years from now, and I still can connect with her. And so what were we saying? Because it's not like I see her every day, but I've known her and known about her for many, many, many years. Like I've been in the field for about 27 years. Mm-hmm. And so when I was here in St. Louis and became a professional, I saw this woman, met this woman. Then we're both alumni of WashU. I go to the meeting, there she is. Hey, how you doing? When I got my doctorate, I finished. I started, then I said I'd finished. So we go in and out. There's this a mosaic in the art museum. It's the weavings, and we are weavings. We all are connected, and we support each other, and we connect with one. That's how we are, and that's how my military friends are as well.
Sure. And that's a beautiful thing, and I can appreciate that, especially as I physically see you two interacting. I mean, every mode you all have been in sync. When you had the hesitant look when you came over, to the look you gave one another, and now to the big, beautiful smiles that you're sharing now. So we appreciate that very much.
Oh, thank you.
And thank you for making time to share with us for our audience.
Oh, thank you.
For both Evelyn and Gladys, their lifelong commitment has been for the well-being of others. And their greatest takeaway involves the mind, body, and spirit connection. And that it's not all about us. How we connect and support one another is where our strength, our value, and our wellness reside. We're excited to have you join us with the Alive and Well STL movement. Alive and Well STL is now a community-wide effort focused on reducing the impact of stress and trauma on our health and well-being. The research is clear. Stress and traumatic experiences are making many of us sick, and together are the leading cause of poor health outcomes. Take 5. Visit us at aliveandwellstl.com to find out where you are emotionally, share your stories, and learn more about stress and how it affects us. That's aliveandwellstl.com. Alive and Well STL is another positive production of Rare Gem Productions. Thanks for listening.